Hi, I'm Dr. Cameron Guild, a cardiologist at University of Mississippi Healthcare. In this segment of Take 2, we're going to talk about cardiac catheterization, commonly referred to as a cath for short. Performing heart catheterizations is routine, but for a patient who has never had one, the anticipation can be stressful. We'll take the next 2 minutes to talk about the procedure. Cardiac catheterization is a procedure where we inject dye into the arteries that supply the heart with blood to see if they're significantly blocked. The blockages are usually formed by years of buildup of fatty deposits, and when they become large enough, they can lead to chest discomfort, shortness of breath, or even a heart attack. While there are several tests used to evaluate for the presence and severity of these blockages, cardiac catheterization remains the gold standard. The cath procedure is usually performed on an outpatient basis. It takes about 15 minutes, and there's only minimal discomfort. A small amount of sedation is usually given to calm your nerves, but you will remain mostly awake for the procedure. If stent placement is required, you'll stay overnight, but otherwise, you'll go home several hours after the procedure. Let's take a closer look at what you can anticipate. This is the cardiac catheterization lab. You'll be brought here, covered with a sterile drape, and a small hole will be made in the leg artery near your groin to accept the catheter. The catheter will be advanced up to the heart and used to inject dye into the arteries, supplying the heart with blood. If your arteries are normal or have only mild to moderate disease, such as this, then we are finished. If we find severe disease, as shown here, you may be a candidate for stent placement. A stent is placed in the artery to restore normal blood flow. And as you can see, the stent is very small, being only 2 to 4 millimeters in diameter. Alternatives to stent placement include medications and/or bypass surgery. Fortunately, only about 5% of heart cath patients are referred for surgical intervention. In summary, cardiac catheterization is useful to diagnose and often treat severe coronary artery disease. The procedure is safe, nearly painless, and most of the time the patient is discharged the same day unless a stent is necessary, and that requires an overnight stay. Thanks for watching this segment of Take 2. I'm Dr. Cameron Guild. Watch for more medical topics on Take 2 at umhc.com.